Welcome back to Air Quality Matters. We already have the tools and knowledge we need to make a difference to the quality of the air we breathe in our built environment. The conversations we have and how we share what we know is the key to our success. I'm Simon Jones, and coming up, a conversation with Georgia Lagoudas and Bronwyn King, the people behind the recent landmark air quality event at the UN in New York. Georgia is a science policy expert and bioengineer interested in tackling important problems, especially at the intersection of biotechnology, health and sustainability. A senior fellow and faculty at the Brown University School of Public Health's Pandemic Center based in DC, and was previously at the White House Office of Science and Technology Policy, and launched the White House Initiative on Clean Indoor Air in partnership with the COVID response team during the Biden administration. Bronwyn is an Australian radiation oncologist and anti-tobacco campaigner. She is the founder and CEO of Tobacco-Free Portfolios, a non-profit organisation aimed to eliminate tobacco from investment portfolios globally. She is a diplomat for the Global Charter for the Public Health by the World Federation of Public Health Associations. Together, they were the two principals behind the recent UN General Assembly event on air quality. This event launched the Global Pledge for Healthy Indoor Air, the first international effort to formally recognise clean indoor air as a basic human right, essential to health and well-being. France, Montenegro and 165 global organisations participated as signatories of this pledge. We discuss this, of course, what's next and why now, and we talk about air quality as a human right and many of the pillars this pledge supports. A fascinating conversation about framing a global problem and building a coalition to tackle it. Georgia and Bronwyn demonstrate what a handful of people can achieve and rightly are recognised as two of the most influential actors in the sector right now. Don't forget to check out the sponsors in the show notes and at airqualitymatters.net. This is a conversation with Georgia Lagoudas and Bronwyn King. I think it is an interesting question, like fundamentally what a pledge is and why something like that needs to exist. So certainly from my perspective, I live in a world where I talk about air quality all the time. I've just had somebody on the podcast this morning. We've been talking about energy performance of building directives and indoor environmental quality standards. And so in a world, in certain parts of the world where seemingly we've got no end of standards and regulations and best practices, why a pledge and why now? What's principally the reason behind this?
We need to have a pledge because we still don't have clean indoor air in buildings. We don't have health-based standards for buildings. We spend 90% of our time indoors, and we don't have any expectation of clean indoor air. It doesn't exist. We don't have it in hospital waiting rooms. We don't have it in schools. And we might have standards or guidelines that point to what should be best practices. But for example, building codes that are mostly adopted worldwide, both in the United States and other countries, tell you what the ventilation should be when you first build that building, but there's often no requirements after you build the building. So a school can go for years and never have ventilation checked. So we haven't fixed it. We have lots of guidelines to point to, and we haven't fixed it. So it's unacceptable that we don't yet have clean air indoors, and we don't have an expectation for it. And that's the purpose of the pledge, is to make clean indoor air a fundamental human right, to declare it for the first time ever as a global community, and to call for an action for governments at the highest level to prioritize this.
Yeah, that's really interesting. So it's kind of a mix of intent and expectation. This is an overarching statement of what society should expect of spaces and the intention of how we achieve that.
Right. And I'll add a little more, and would love to have Bronwyn join in too. One thing that, I previously came at this from working at the White House, and we brought this to the highest level. And the analogy that I came across and we shared was that You turn on the faucet and you expect clean water to flow out of the faucet. And yet when you walk into a public building in the United States, we often have mechanical ventilation, so you can look up at the vents, but there's no expectation for clean air to be flowing out of those vents. And yet it can be just as impactful on your health of the water you drink as the air that you're breathing. And so this pledge is creating a symbolic, high level, really impactful from this basic of clean air should be a priority. And by hosting this event that we had last month and raising it at the highest level, it was trying to put it on the global stage to say, let's talk about this and really push both governments and individuals to demand clean indoor air.
And if I can jump in there, Simon, I think the other really key element about it was to create global solidarity on the issue. My background is in radiation oncology and more recently in tobacco control. And I've seen such great examples in those communities of how when you identify all of the key players who are working on an issue all across the world, if you can get everybody to work shoulder to shoulder and stand side by side at the United Nations, and ask for the same thing and to say, look, we've all identified that this is a gap, this is important, and we are urging our leaders of all kinds to take notice and to act. There's an enormous power in that. And so I've been very fortunate to have been involved in previous global collaborations. And once I got involved in indoor air quality, I kept meeting great people all around the world working on the same issue and fighting the same challenges and running into the same barriers, and creating a global community of advocates, which has perhaps been a little bit missing from the indoor air community previously. There's been many experts working on it and scientists and deep technical experts, but having a new community of advocates is really a powerful thing. And so it was such a pleasure to be there and to be alongside Georgia co-hosting that event at the United Nations. The energy in the room was, in my view, unmatched compared to any other conference or event that I have been to. It was full of optimism and positivity. And for those who weren't there, when we did launch the pledge at the United Nations, we had a signing ceremony and we invited a representative of every organisation who had signed to come up and actually be part of the event at the UN by signing and having a photo and shaking hands with some of the experts who'd spoken. And we weren't sure how that would go. We didn't even know if we should include it, but it turned out to be, it was certainly my favourite moment of the event. It was a great team. There was just a great team spirit in the room, and it felt like together we could really make this happen.
I want to roll back a little bit to what Georgia said, because I think it's really interesting that you used the water analogy. And I think that's the thing about the pledge. You're rolling in behind a simple truth. And sometimes it's that logic, it's that simple truth, the intent behind what you're saying that's what's missing. This is indoor environmental quality in the whole is a multidisciplinary venture of engineering and building science and public health and social science and governance, and the list goes on. And the risk is we all end up siloing. And as you say, there's plenty of experts, but sometimes what you need is an overarching truth, something that everybody understands instinctively is what we're saying as a collective, to roll in behind. Is that fair to say?
Yes, absolutely. And maybe I'll share my own story of how I arrived at this. And Bronwyn has her story of how she arrived, but it's interesting because I approached this as an engineer. So I'm a PhD engineer ready to roll up my sleeves and say, what is the technology that can solve this problem? And so when it rose to the forefront that we were in a respiratory disease pandemic and not using clean air technologies to remove pathogens from the air and be safer, I was like, oh, well, it's definitely a technology hurdle. So let me interview 36 experts and ask them questions and say, what can we do to have cleaner air in buildings in the United States? And so I went on around, kind of a roadshow for a month, and interviewed experts. And 90% of those technology experts said it's not a technology problem, it's an implementation problem. We don't have the willpower or the leadership to say go for clean indoor air. We haven't put funds to it. We haven't prioritized it. We haven't created capabilities for school district leaders or states or local leaders to do that. And that surprised me. It's easier if it's a technology problem. And of course, there's, a few technology improvements we still need and can help the issue. But I think, as you said, there hasn't been a prioritization of this or a demand or a cost of inaction for not having clean indoor air. And we haven't been able to describe the problem either with stronger advocate voices, like Bronwyn said, or from other angles to make leaders be very clearly aware of the cost of inaction, to say this is unacceptable. And I think that's where I didn't expect myself to be involved, as an engineer trained to be involved in some ways of like, how do we create a social movement around this? But as Bronwyn said, creating global solidarity to say this is a priority and we can't not act. Action is inevitable. That's what we want to drive. And so that's what we hope this pledge and the momentum from the United Nations event will help lead to.
Who's this for then, the pledge? Is it for the people signing it? Is it that by signing it, it makes it visible to another group? What's the purpose of the pledge itself? Who's the customer of this, if you like, ultimately?
Well, we would love to see more governments sign. I think governments are our ultimate customer in that they hold all the power that can create change for populations all across the world. But when we say governments, we have to be realistic. There's political cycles that we have to tap into. There's ministerial changes. There's people who have particular subjects or projects that they're interested in. And so with that pragmatic point of view, we don't just want to welcome federal governments. We want to welcome provinces or states, cities, councils. It doesn't really matter which sort of level of government. We want whoever is on board to sign up, because every signature at a government level will make the next one easier. It will help sort of turn that snowball, if you like, get it going, and with time it will grow and grow, and every new recruit is much easier to encourage to sign. But in addition, we are talking about businesses, schools, organisations, small and large, and we're very pleased that at the launch of the pledge, we had 165 of those organisations from over 25 different countries signing up to the pledge. Since then, I think there's been another 100 signatories. We haven't even had time to work through them and process them all. But that's in itself is really terrific to have organisations like, the US Green Building Council signing up, the Green Building Council of Australia. So sustainability, peak bodies, engineering groups, hospitals, school systems, you name it. Any organisation can sign up if they are, if this issue resonates with them and if they are keen to take some action. It is very symbolic, though, as Georgia mentioned. So this is a good-spirited, symbolic pledge. This is not about catching anybody out for doing the wrong thing or having any negative connotations. This is about seeing people and meeting them where they are and welcoming them on a journey of better. Not perfection, but of better, making things better today than they were this time last year, and hoping that, and actually planning for next year to be better still. We know that achieving indoor air quality, unfortunately, takes some time. We understand that. We also know it's going to be a bit messy and imperfect, but that's okay. As long as we're moving forwards together as a community, we'll ultimately continue to be in a better place.
And I guess as a global pledge, you have to have that realpolitik there, because countries are in very different positions and have very different worldviews, have very different political views depending on where they are in political cycles. They have very different economic statuses and health challenges and geographical challenges and so on. So this is a messy, complex world, and the pledge, if it's for the entire global family, has got to be accommodating in that sense, hasn't it?
Yeah, exactly right. And I mean, this is also one reason why we need that global solidarity, because sometimes for advocates who are working very hard in one country, if their political cycle is just not right at that time, they can take great heart from knowing that other countries are able to make progress at that moment, and they can learn a lot from that, so that when the time does come for them, they're ready, they've learnt what works, learnt mistakes and not to make those. And I've certainly seen that in the tobacco control world globally, which of course is, tobacco is one of the world's greatest challenges. It's such a tricky issue to address. But there's so much, hope and optimism that that can keep you going even when times are tough in your own jurisdiction.
The other thing I'll add in, Simon, is that in this topic, you had mentioned at the beginning, indoor air quality falls amongst all these disciplines. In some ways, it's great because it brings such a multidisciplinary team together, but it also falls in the cracks. This is exactly true in the United States. Like, there's not one core department or agency in charge of this. This is the same in most countries. Is it health? Is it environment? Is it public health? Is it workplace safety, et cetera? And in some ways, there hasn't been a banner movement or a spotlight to be able to shine on the progress for indoor air quality. This concept of name and fame. How do you say the progress you're making and uplift that, showcase that to your other peers, and then others can learn from what you're doing or be excited to join that effort? And we made strides with this for clean energy and reducing outdoor air pollution and trying to meet new metrics for carbon emissions globally. We've created global movements for that and many other things for global health security. And that created a coalition of entities that said, here's some leaders. Let's get excited to join the movement and be a part of that. And that hasn't happened for indoor air quality. And part of it is that it's unclear who the champions are and who to shine the light on and how to do so. And so hope is in this movement, we're suddenly creating a fear of missing out, so that you want to be up there along with those leaders. France and Montenegro were the first two countries to sign the pledge. It's wonderful to have these two different and yet, very distinguished countries being able to say, these are actions we want to take and we want to put on the global stage, and let's put others up on the global stage with them. That's the purpose, and that's our hope, that we can create this snowball effect.
One of the things you were saying there really reminds me of back in the early days of sustainability. There was a movement in Northern Europe called the natural step. I don't know if it ever made it over to your parts of the world, but it was the early days of sustainability where they were trying to provide roadmaps to organizations of all descriptions on how to have forward momentum in what was a very complex world at the time, and a lot of the structures that exist today didn't back then. And they had a couple of really good mind imaging kind of ideas about how to bring all of this complexity together. And one of the ones that always stuck with me was this idea of a tree, where in sustainability you can get stuck on the detail in your particular discipline or silo or whatever it is, and you could spend the next 20 years arguing whether electric cars are good or bad or whatever, right? Or whatever the particular thing is. And each one of those things are a leaf on a tree, a big tree. But ultimately we can all agree what a tree looks like. We don't, at a high level, we can start to have some basic principles about what we think good looks like without necessarily getting stuck on deciding what shape and color a particular leaf needs to be. And I think that's the beauty of a pledge. It's this idea that we can agree that air quality is important, we hope, and start to build some basic frames around that discussion that everybody can roll in behind, without necessarily getting stuck in the weeds on what level of particulate matter should be right for every country on the planet, right? That's, a conversation that's going to take a very long time to sort itself out, if it ever does. But in the meantime, we need a common language to roll in behind and really get behind a movement on what we think good is for people.
Yeah, I think that's a great analogy. I love that. So Georgia and I went to plant a tree. That's effectively what we tried to do, plant the tree. And exactly, we welcome everybody's contributions in branches, leaves, twigs, whatever. But that's it. If we can all just agree that the tree is really important, we can certainly make it grow faster. So I love that, Simon. Thanks.
Yeah,
we'll have to
I robbed
that.
it. It's the natural step. There's a couple of ones actually with the natural step. One of them was the tree kind of idea. The other one was they started to introduce this concept of backcasting as opposed to forecasting, where you understand what the ideal looks like and start to set up a series of roadmaps to get there. And you can change direction on your way, but you know what the direction of travel is. And the other great one they had was the funnel. And that was this kind of the argument over whether or not we need sustainability or not. And they were saying, well, we can broadly agree that the need for resources is increasing, and we can broadly agree that the resources are decreasing. At somewhere there's a funnel, and what we've got to figure out how to do is navigate through the mouth of the funnel at some point. And so they were very good at creating these ideas around big problems in the early days to get people to figure out the principles. What direction are we actually all heading in? And I think there's a lot of resonance there with what you guys are doing with this pledge. So for people that aren't familiar, and obviously we'll share loads about the pledge, there are some kind of core ideas behind this pledge. This isn't just we think air quality is great, everybody agree. There are some kind of principles behind this. And the first one and the standout is this idea that air quality is a human right, that this is a human rights issue.
Yeah, I mean, I think that this really gets to the heart of it. If we go right back in 2000, the World Health Organization had a working group that declared that everyone has a right to healthy indoor air. So that was 25 years ago. If we go back just 3 years ago, the UN adopted a resolution declaring that everyone on the planet has the right to a clean and sustainable environment. And that includes clean air wherever you breathe it. And as Georgia mentioned, 90% of the time we breathe our air indoors. Having said that, we wanted to do something that explicitly called out indoor air quality as an important issue on its own. So without being attached to anything else, just indoor air quality is important enough to have an explicit call out when it comes to human rights. And so as far as we know, this is the first time there's been anything of this sort, a pledge, a global pledge that really makes that very clear. And as you mentioned, Simon, when we crafted this pledge, we were thinking about everybody in the world and the different angles and the different lenses through which they might be looking at indoor air quality as an important issue. And so we did take our time to really consider what are those lenses, and let's specify them so that whatever it is that has brought you to indoor air quality, you feel part of this, and you can go as deep as you like in that particular area. And so the main areas that we identified, one was the human rights angle, two was just health. Just health alone is enough to prioritise indoor air quality, health in the short term and health in the long term. And many people think of indoor air quality and just think of the lungs. And of course, that's a very natural thing to think of. But in fact, research is very clear that poor indoor air quality impacts just about every single organ in your body, in particular the heart and the brain. These are two organs that people have often sort of not thought about when it comes to pollution or pathogens in the air, but there's very strong evidence that shows that your brain function and your heart function are related to the quality of the air you breathe. And we need to really increase knowledge around that. So health was the second thing. The next thing is pandemic preparedness. It just frustrates me so much that we had such a catastrophic global shock in 2020 and 2021 with COVID, an airborne pandemic. And airborne diseases are overwhelmingly spread in indoor environments. And yet we haven't, as a global community, committed to pandemic proofing our buildings. And the way to pandemic proof your buildings is to make sure the air is of the highest possible quality. Isn't it amazing to think that had our built environment had indoor air quality standards back in 2020, it's possible that we may not have needed lockdown anywhere. We may not have needed to close schools. we may not have needed to close workplaces because our schools would have been safe, our workplaces would have been safe. It's just amazing to think that technology was available, the knowledge was available, but the action hadn't happened. And as a result, the entire world suffered dreadfully. It is inevitable that there's going to be another pandemic, and we are not prepared. So that's a very big element.
Let's go through them, and then we'll come back to a couple of the ones in detail, because I don't want to forget where we are in that. So we got pandemic preparedness. You've also got climate resilience in there as well. That's an important piece. This stitches into the sustainability conversation, doesn't it?
Absolutely. I mean, as the world gets hotter and hotter, that figure of 90% time indoors is only going to go up and up. And in countries like mine, in Australia, we have absolutely devastating wildfires every year. And it's not just the fire that causes the problem. It's the enormous billowing plumes of smoke that blow thousands and thousands of miles away and cause absolutely hazardous air quality situations, not just outdoor, but that air comes straight indoor. It comes in my own house every year. And I didn't really know that until about 2021, when I had air purifiers everywhere for the first time, and they all started to flash at me and go red. So I know for a fact that, I was nowhere near a fire, but the air quality inside is very poor when these fires occur. And we know with climate change, there's going to be more fires. They're going to be longer. And of course, it's not just Australia. We've seen this happening in Canada with terrible effects in the US, especially in New York a couple of years ago. But we've seen fires all over Europe and fires in countries that have never had fires before. And that is the reality that we are going to see moving forwards with climate.
And then you've also got workplace health and safety. I think it's interesting that you've tied in the workplace into this, the health and safety angle.
Well, that's right. I think that in many countries, it's not controversial to expect workplaces to provide a safe environment for employees. And up until very recently, airborne pathogens and airborne hazards have been getting a bit of a free pass on that, much to the frustration of many people on the receiving end of poor air quality. I'm very happy to say that recently in Australia, there was a new model code of practice that was issued by Safe Work Australia, and this specifically applied to the healthcare sector. And it now, for the first time ever, requires hospital providers and healthcare providers to eliminate or minimise to as low as possible the risk of workers contracting biological hazards in the workplace. And they specify airborne pathogens, and they use influenza and COVID as examples of the diseases that you must be preventing your workers from getting in the healthcare sector. So this is a really great angle for us to focus on in Australia, because it taps into a very well-known policy structure. It's well understood, but it's really uplifting those standards to mean more than they ever have before. So if that's what's working for you in your country, there's a good lens to use.
And finally, and last but not least, you've got the accessibility and inclusion lever here, which I think, these aren't in order of importance, but this is a really powerful addition to those list of pillars, isn't it?
Absolutely. And again, it should just be a no-brainer that hospitals are safe, schools are safe, workplaces are safe for everybody. So that if you're very young, if you're elderly, if you have a comorbidity, if you have heart disease, lung disease, cancer, diabetes, any immunocompromise, any comorbidity, you should be able to go to any public space and be confident that that space is safe for you. And Plum Stone, who runs the Safer Air Project, delivered a beautiful quote during the launch of the pledge. And I won't get the quote exactly right, but the sentiment was, the same air has different consequences for different people. And if we clean the air, then everybody is safe. But at the moment, it is disproportionately negative for many people who suffer from chronic diseases, or people who live with those who suffer from chronic diseases. And as Georgia points out, There are already the solutions there. We simply need to implement
Well,
them.
let's roll back to the first one, and I would like to go through these in a little bit more detail, because I think it's a really good picture of where we're heading: human rights, health, pandemic, climate resilience, workplace health and safety, and inclusion. I think these kind of frame, it's a bit like the sustainability development goals, isn't it? The SDGs of air quality. It sets the building blocks that add up to air quality. But I'm fascinated by this idea of air quality as a human right and the power with leading with that. That not that these are in necessarily an order of priority, but there's something in leading with this as a fundamental human right, isn't there?
Yes, absolutely. And this was, I think, to Bronwyn and I, a clear no-brainer that this should be the leading hook, that we should have an expectation of clean indoor air. It should be an expectation. It is unacceptable that it is not. We have clear evidence of all of the negative consequences of clean indoor air. We have the opportunity to make those changes and technology to make it. And we as a society should be or are arriving at the point that it is not fair to provide poor indoor air quality. And we have decided as a society that clean water is a fundamental human right, and clean air broadly is a fundamental human right. And so we are taking that next step to say this also applies to clean indoor air, where we spend most of our time. And I think this is at the crux of everything, and we've spent the past number of minutes talking about it. That this is, in some ways, this is the most obvious and yet the least uplifted component of this, that clean indoor air is a fundamental human right. And so we're excited to be able to lead with this.
I think what's interesting for me about human rights is it gives a direction of travel from a place that we know is difficult, where we've done this before. We've got frames for this, the idea that education is a human right, access to water is a human right, access to shelter is a human right, and so on and so forth. We know these global challenges that manifest in different ways in different parts of the world for different groups are not fixable in the short term, but it's important to recognize the direction of travel, because it builds a frame that we understand as human beings, that while we live in an imperfect world, we know the ultimate goal as a society. And I think the first, it's that frame. And then for me, the other one is it leans into fairness. And I think the human beings instinctively relate to fairness at an individual level. It's very difficult with global standards, I think, for it to resonate, because they're often buried in jargon and language that's very alien for people to understand. Trying to explain embodied carbon to people and things like that are very difficult to do. But fairness is a fundamental human emotion. We all get that. And, I always said that the people that instinctively understand fairness better than others is toddlers. But about sharing toys and fairness, and about who everything should be split equally and so on. That we get this from childhood upwards. Fairness is a thing for the human species, isn't it?
Right. And in some ways, Simon, you can flip it. And I want people to say it's unfair that I don't have good air quality in this space. It's unfair. I walk into a hospital waiting room and I'm surrounded by other folks with disease, and there's not high levels of air quality here. It's unfair that I send my kid to school every day for 8+ hours and they're breathing subpar, unsafe air. That's unfair. That's what we want people to be demanding and claiming. And I think with larger and larger groups of voices, that will then become something we as a society can't ignore.
Yeah. Yeah, and I think it's really interesting. Yeah, it frames it in a way that it empowers people to be able to say this is not right. I can't articulate necessarily exactly how this isn't right, but it's not right, and I deserve better. And I think at a fundamental level, that's really powerful. I'll get you back to the podcast in just a moment. I'd just like to take a minute to tell you about Zenda, one of our partners. Zenda is one of those companies that, if you're working in indoor air, you've probably come across. They really cover the full spectrum when it comes to ventilation, from simple mechanical extract right through to full climate systems where fresh air is enriched with heating and cooling. They offer the ventilation units, and they also offer everything around it: air distribution components, smart controls, the expert advice to make sure systems actually work as designed. One of the things I really like about Zehnder is their focus on knowledge through their experience centres and the Zehnder Academy. They help professionals keep pace with this fast-changing world of indoor climate. Whether it's tackling overheating, improving indoor air in tight retrofits, or simply making sure your filters are doing their job, Zehnder brings experience, depth of knowledge, and clarity to the conversation around healthy buildings. So if you're involved in building design, housing, or indoor environmental quality, they're really worth checking out. Details are in the links in the show notes at airqualitymatters.net, of course, and at Zehnder, that's ZEHNDER group.com. Now, back to the podcast. There's a lot of parallels with what you've done there, Bronwyn, with tobacco-free campaigns. Is this leaning into human rights and fairness, and just at a fundamental level that something's broken? Can we all agree we need to fix this?
Yeah, absolutely. And again, with, I've had a very interesting journey in tobacco control over the past 15 years, and it's very frustrating when you want to fix things. You can see the problem, you know the solution, and you've got to convince all of these people all across the world to come on that journey with you. And so I've learnt to be very strategic, and really try to think about the very best way to bring people along. And as an Australian, when I started to do my work on the global stage, I had to really carefully craft the conversations I had in every country. So every country, while I was flying in, and you have a long time on the plane as an Australian, so you can have a lot of good thinking time to prepare your strategy. But I would always think really carefully on the plane. Now, where am I going? Think about the cultural view of tobacco. What's the policy progress on tobacco? Are there any tobacco companies here in this nation? What are the levers? What's going on? What is everybody else doing? And then I would sort of set my thinking, land, and make sure that I stuck to that thinking while I was in that country. And so I really had to learn how to tap in to what would work locally. And what would work in one country may be completely, and was often, very different to what would work in another country. So I guess I tried to apply that thinking, and I'm still trying to apply that thinking. I think about indoor air quality all the time. So I'm constantly noodling and trying to work out other strategic ways to encourage leaders to pay attention and to make them understand what the scientists understand, because I don't think that there really is any disagreement amongst the scientists. We know that poor indoor air quality is causing harm. It's causing harm right now, and it's not fair. It also is not honouring our commitments to work health and safety. We are not a climate resilient world in terms of our buildings, and we haven't prepared for the next pandemic. We're also not upholding basic human rights. So there's all of these reasons why we need to move forwards. But when it comes to capturing the attention of a leader, it's not about the science or the maths. It's about an emotion. It's about the story. It's about capturing people's heart. And I think we need to do that a bit better. And Georgia was speaking before about, some problems. One of our problems, I think, that we have is a little bit of a messaging or a communication problem because of the invisibility of air, because you can't see the hazards. And I think that has allowed leaders to sort of kick the can down the road and think, well, you know what, there's another very obvious problem right in front of our faces. The public's aware, everybody's calling for change. But with indoor air quality, I think it's a communication problem. We need a better way of showing the world that the air is currently very poor in a huge number of indoor spaces. And I think that there's there's a big opportunity there for us to improve that messaging.
There's a couple of thoughts from what you were saying there. The first one being is I need to be a lot more productive on planes, listening to how you behave. Usually I'm slightly inebriated watching rubbish movies on long haul flights. Not yeah,
I'm usually
feeling rather guilty now. I think that's absolutely true on the trying to frame this for people. And the big challenge with air, I think, is agency. If we don't like the taste of water or we feel it's a risk, we can make a choice not to drink it until we get home. That doesn't work out very well for you when it comes to breathing. You don't get to not breathe for a couple of hours because you don't like the quality of the air in a meeting room. So I think at a fundamental level, humans are actually hardwired not to think about the air we breathe. It's such a basic instinct right in the base of the brain. It's the last thing that leaves you when you die, in fact, is the need to take a breath. That somehow we're hardwired not to think about it. So we need to rely on the crutches of society around us to provide us with decent quality air. I've been using a really interesting thought experiment recently, actually, about air quality, and I've been describing this idea that imagine buildings that have an incredible ventilation system on them. Every building, every home, school, college, nursery, hospital has a brilliant HVAC system on the roof. And each one of those systems has got a brilliant filter that filters out all the pollutants from the air. The only catch is, instead of it being a filter that you can remove, it pipes those pollutants into the water system of the building. And every day, 24 hours a day, the pollutants that are captured by this amazing system are piped into the water that you drink, that you cook your food in, that you bathe your kids in, that you wash your house down with, everything. And that's just the way it is. You don't have a choice. That's just the way buildings have to work. You'd be outraged and you would demand that the only lever that you can pull is to clean the air up. That if that's what's going to happen, I don't want those filters capturing those pollutants. Well, we have that system. It's our lungs. Our lungs are incredibly efficient systems at collecting stuff from the air. They're designed to do that. Otherwise, we'd fall over. We wouldn't be able to collect oxygen and get rid of CO2. So they're perfectly designed to capture pollutants 24 hours a day, 7 days a week in every building that we occupy. That's just the way it is. We don't get a choice in that. So the only lever that we can pull is to remove the pollutants from the air around us. And it's that lack of agency that I think drives the need for pledges like this, because as a species, we don't get a choice. I've been sat in this room for 40 minutes with you guys, and not once have I, even though we're talking about air quality, not once have I gone and thought about the quality of the air that I'm breathing. We're just, even for...
I have, Simon, because I'm sitting next to my air quality monitor. I'm like, ooh, the CO2 is ticking up quite a bit in here. I should open up my window.
The most common comment I get from people is that my light's changing colour here behind me. I'm not looking at them and they're going, oh, yeah, your air quality is deteriorating. But it's even for people that focus on air quality. We go for days and weeks and months without actually, thinking about a breath of air that we're taking. So it's a huge challenge we've got from the human rights angle, but it feeds into the health piece really neatly as well. And obviously health here is a core pillar of this, not just acute impacts of infection risk and exposure to carbon monoxide and things that are going to have an impact on us immediately, but the well understood chronic impacts of health over the long term of our life. And I think that's a really fascinating thing to include. It's obvious, obviously, that it should be there, but it's a bit like air quality is a human right. It needs to be said, doesn't it, that this stuff matters. It's costing society in health and well-being almost incalculable amounts of money.
Yeah, and unfortunately there hasn't been any real estimate of the true cost of poor air quality. For example, the WHO uses a number of just over 7.8 million deaths per year, which is the quoted number of deaths from indoor air quality. However, that quoted number of deaths from poor air quality, full stop, that's indoor and outdoor, and about 3 to 3.5 million of those are from indoor air quality. However, that really is only considering the terrible impacts, albeit they're shocking impacts, in low and middle income countries due to the burning of biomass for cooking. That's the only indoor air quality consideration in that calculation. I would love to see a number that includes everything. So, for example, we know that overwhelmingly airborne diseases are transmitted indoors. They should count, or I don't know, you can pick 90% of all airborne diseases. If they result in deaths, those deaths should count as indoor air diseases. I feel like we should create a new category of disease and call them indoor air diseases. There should be textbooks on indoor air diseases. I certainly didn't see one when I went to med school. There weren't any. There still aren't any. It's not. We don't think like that in medicine, whereas we should. The health of your building has a massive impact on your personal health.
Interestingly, there's been some really good work by Nottingham and Lawrence Berkeley National Labs on harm intensities of indoor environmental quality. They're typically looking at homes in the Western Hemisphere. So looking at homes like the US, Europe, those kind of countries. And they've been translating the harm of exposure to particular pollutants to DALYs, to disability adjusted life years, so a public health measure, and the total harm of exposure to those pollutants based on the available evidence at the moment puts the DALY count close to that of tobacco smoke, and twice as much as road traffic deaths and alcoholism. So the level, I think it's up at around 2,200 years lost to early death and disability per 100,000 of the population, which puts it in an order of magnitude to the harm intensity of exposure to tobacco, which I know you like, Bronwyn. So I think it shows the magnitude of this, and it shows that actually just building to code reduces that DALY impact by half. So brings it down to a level that we consider nearly acceptable. So where we've got good standards around road traffic safety and, access to alcohol and things, that we can bring it down to the thousands and below. So we can, this stuff matters. Like this, the health impact is real and substantive.
The other piece that I'll add, Simon, which I think connects us with the other component of pandemic preparedness and also health, is, as Bronwyn was saying, there are not great economic analyses of this impact. There have been, I think, communications from for-profit companies that say, why should you buy this certification product or something for clean air, which makes sense. How can you raise the real estate value of your business? But we haven't communicated. We don't have a lot of economic analyses on the broader health impacts, as Bronwyn said, considering indoor air disease transmission as a part of global deaths or per country deaths. I haven't seen many analyses. This is in some ways a call to action of any economists out there listening. These are great projects to pick up that we haven't even done kind of a post hoc analysis of COVID transmission or spread of COVID to say if we had twice as much ventilation inside, if we'd all been using MERV 13 filters, or if these set of buildings had all been following the highest level of building ventilation standards like ASHRAE 241, what would it have looked like for a nation to go through the COVID pandemic? It would have looked absolutely transformatively different. And how can that model savings to that country? And then suddenly that becomes real when we put dollar values to it. And I think that is not only for health impacts, for pandemic preparedness, that goes also to climate resilience. I'll say this component that there was a study a few weeks ago out of Nature in the United States that looked at Canadian wildfires and the North American impacts of climate change, and assessed that poor air quality is the number one health impact from climate change. Poor air quality is the number one health impact, and most of that is from wildfire smoke exposure. And we're not putting out those wildfires anytime soon. So we better have better measures for better indoor air quality.
Now, Georgia, you need to send me that. You need to send me that paper. And Simon, I'm just about to go to COP30 in Belém in Brazil next week. And as far as I'm aware, I think that I'm hosting the only event on indoor air quality during COP, as far as I know. I hope I'm wrong. And if I am wrong, please, if anybody else is hosting an event, please make sure you tell me, or I hope I'll find out when I get there. But that is just such an important point. Air quality is one of, if not, the leading health concern around climate. And yet here we are having the first event at the COP30 this year. So let's hope that we can certainly get a little bit more interest in years moving forwards. And Simon, for example, next year at COP, we would love to be welcoming a range of new governments to sign on to the pledge at that event.
One of the things you have in here, obviously, is pandemic preparedness, and that's obvious for a lot of reasons, considering where we are. It always strikes me it's a bit like we've had a near miss from an asteroid, an Earth-changing asteroid in the last 5 years, and we've decided not to continue looking at the sky after the event. There's an element of needing to focus a little bit more on what's just happened and see it as a near miss, and start getting our buildings ready in all seriousness for what could be much worse next time round. There's a lot of standards like Standard 241. There's a lot of guidance from organisations like CIBSE and REVA, and internationally a lot of countries have looked at this and have started to build a picture of what resilient buildings look like, in the same way that they're looking at climate resilient buildings, but not a lot of action happening on the ground. And I think it's good to see this lever in here. What's been your sense of the post-pandemic era and the need for its inclusion still in something like a pledge?
Well, look, I mean, I think first it's really important to remember we're still in the pandemic. So COVID is still causing waves of disease all across the world. And we know that there's been over 20 million deaths so far. But we must acknowledge that there's a significant number of people who end up with long-term complications, serious health impacts that are loosely termed long COVID. But long COVID is now impacting hundreds of millions of people across the world. And at the moment, there's very few, if any, proven treatments. There's lots of wonderful researchers doing research, trying to find better help and support for people suffering long COVID. But the most frustrating thing for me is that we haven't turned the tap off here, that we're continuing to see infections daily, and we know that there's at least a 5% risk of long-term problem. We saw an article that came out in Nature just a month ago showing that children that had a reinfection had double the risk of long COVID. So we're still in a pandemic. And while for some people they've managed to only have very minor impacts, there's a very, very large number of people across the world who've had dreadful impacts and continue to have very different lives to the ones they used to live because of COVID. And so if we can lean into that, which I know is very difficult. So being in Australia, being a Melburnian, we had 6 lockdowns in total. We had 2 lockdowns that lasted for 100 days each. So we had very sort of significant impacts here. And I have spent so much time thinking about why it's become so difficult to talk about COVID. I spent my whole working life as a cancer doctor, and cancer used to be the C word that people would never want me to say, and I had to learn how to have entire conversations about cancer without saying the word cancer, and I sort of mastered that. And now there's another C word that we can't seem to use because no one wants to talk about COVID. Leaders don't want to talk about it. The community doesn't want to hear about it, and I think there really is some community-wide trauma about that has come to be, and you're right. Everybody just wants to look another way and pretend it's all over. For some people, especially those with chronic disease, some people just don't have that luxury. And as leaders, I think it's our responsibility to have the difficult conversations that nobody else wants to have. That is the job of a leader. That's exactly what great leaders need to do. They need to talk about what needs to be talked about and reach out in a very kind and compassionate and sensitive way to the community and bring them on board and make sure that we acknowledge that this is still a problem with COVID now. There are other airborne diseases that can also be fixed if we fix indoor air quality, like influenza, and everyone knows about influenza, but there's common coughs and colds, there's measles, there's tuberculosis, there's RSV, there's all sorts of indoor air benefits. It will, hopefully, it's very likely to significantly reduce the risk of all of those diseases, and it will offer an incredible insurance policy around the next pandemic. And we know for sure there's going to be another pandemic. It's just a matter of when. And given that COVID has caused so much trauma, why on earth wouldn't we want to be robustly prepared for the next one?
Yeah, and it's not like there's not a lot of co-benefits with this stuff. The meteor analogy, which is cheeky, especially with the Don't Look Up movie, but focusing a lot of effort and resources on, I don't know, missiles pointed at the sky for the next meteor doesn't come with a lot of co-benefits. But fixing air quality for the next pandemic comes with an enormous array of potential benefits. I remember chatting to Plum about this, about accessibility. We understand that why ramps need to be available in all public spaces for people in wheelchairs to access the same spaces everybody else can. It also comes with an enormous amount of co-benefits for people that have other mobility issues and people with kids with pushchairs and everything else that goes with it. There's enormous co-benefits to accessibility for spaces and improving spaces generally. And air quality is no different from that. We improve the access for one child with a vulnerability in a classroom. We improve potentially the academic outcomes of all the kids in the class, and the absenteeism and presenteeism and issues of health and safety in the workplace for teachers. And the list literally goes on and on and on. And that's the beauty of this, that this is one air, it impacts everybody. And most of the things on this list, every time we improve this for people within society, we improve it for everybody else around them at the same time. I'm not aware, medically or scientifically, any negative unintended consequences for improving air quality for people. I don't know about you two.
Everybody wins. Everybody wins.
And that can't be said often.
Can I add in one piece and a story maybe to tie some things together we've shared? One is the US government spends tens of millions, if not hundreds of millions, in developing vaccines and devices and therapeutics to protect against future pandemics and future disease threats. We stockpile respirators and other protective equipment. We stockpile therapeutics. Billions of dollars are spent in this ecosystem of medical support and prevention. We don't spend anything close to that at all. We spend pennies in the United States federal government. I've had a hard time to even find indoor air quality research programs within the National Institutes of Health or CDC. These are $100,000 programs, if that. And what you outlined, Simon, we can reduce, if we improve airfold twofold, if we improve air quality twofold in a building, we can reduce transmission by 50%. That's it. That's the bottom line. You can remove half of the particles in the air and reduce your exposure by 50%. So it is a no-brainer. And we haven't really recognized the opportunity for health and pandemic preparedness. And my one quick story is that I'm working on a project with nursing homes or elderly care homes in the United States. And this ties to this concept of, we kind of know we should do something and yet we haven't. And why should we do, what is the purpose of this pledge? So to my knowledge, there's essentially one study. So nursing homes are the number one, had the highest death rates of COVID in most countries, absolutely in the United States. It was absolutely terrible to see the amount of deaths in nursing homes. And the CDC and other public health institutes didn't prioritize indoor air quality or provide guidance to say this should be done. So we did a study of interviewing some dozen plus nursing home leaders to understand how or why they could incorporate indoor air quality to reduce disease transmission. And there has been no activation to say, hey, these are tools and actions you can take. There hasn't been government push or government support. And there's essentially been one study that I can find globally that shows if you put an air purifier in a resident room, Bronwyn, the numbers there is they find about 50% reduction in all-term respiratory disease infections. That's absolutely phenomenal. Like, yes, we should do that. There's no downsides.
And they cost, what, $150, $200 to stick them in the room? I mean, this is it. These solutions are not, they're not only very expensive, high-tech solutions that will take years and years to implement. There's some stopgap solutions, like an air purifier plugged in and turned on, that are very effective and would go a long way to many steps forward.
Yeah, and look, air quality is a risk problem, and there are, as you say, communities and people in vulnerable parts of our society that are exposed the most, or have the least agency, or are more vulnerable than others. And in the right circumstances, the benefits of doing the right thing are just such a slam dunk that it should almost be no argument. Elderly care clearly are a very vulnerable set of the community. They sit in a middle ground of not quite medical, not quite residential spaces, so their regulations are often a little bit out there. And we can have a major impact for not a lot of money in those spaces by, like you say, introducing filters. And then at the other end of the spectrum, children, people at the start of their life, where we're bedding in lifelong issues at an early stage, creating the foundation for challenges for the rest of their lives and compounding them. It seems to be an absolute no-brainer to me that we shouldn't be, we start those two ends of the spectrum in most of society, we'll have a major impact in outcomes.
Exactly. I just want to know when we get to vote for you as the health minister, Simon, because I think you're going to get a lot of votes if you keep speaking like that.
Well, you'd think, wouldn't you? But then I know a lot of political people, and they're very attuned to this kind of stuff. You wonder why this isn't more of an issue. They're looking to, maybe it's because the young and the old don't vote, Bronwyn.
So that's it. I think it's a really good point to say that these people have very small voices when it comes to creating change. And certainly, as a mother myself with 2 kids at school, I mean, I have tried and tried and tried and tried, and it is very hard. I think that other parents in the community don't realize, A, there's a problem, and B, it can be fixed. So again, it comes back to this messaging crisis that I think we have, which is this is an invisible problem. People don't really know what's going on, and they don't understand that the tools are already here and that they're not expensive. It's more structural and leadership that's required, that it's not huge cost. In fact, we'll save money by implementing these changes that we're advocating for. But really, schools are absolutely high risk zones. We've got loads of kids in small classrooms, and the vast majority of the time the windows and doors are not open. It's either too cold, too hot, too windy, too whatever outside, and very few schools have mechanical ventilation, certainly in Australia. So we have a major problem with our schools here, and we really need to increase awareness of that and increase awareness of the fact that the solutions are there.
Let's talk a little bit about the action, because I don't want this to become a self-patting on the back exercise between us all saying how important air quality is, because I think we're all pushing on open doors with each other there. But this is about action as well, and what there are some pillars around action for this type of pledge. And if I read a few of them out, it's about advocating for action, collaboration, sharing and communicating, education, and bringing in new stakeholders. There's an ask here behind this pledge, isn't it? It's not just a signatory to say, we agree with you, air quality is important. We want people to do something with this substantive and, really start to drive this forward.
Yes, absolutely. And I think the first one you said, Simon, I can break down because I think it has a lot of components, which is prioritize and advocate for action on indoor air quality. And some of that is breaking that further into what actions an organization or a government can take. So one of our next steps from the pledge will be putting some of these together in a guidelines document for entities to be able to choose essentially from a menu of option and learn from what others have done. But I'll briefly share Montenegro was one of the countries that signed the pledge. And they announced at the United Nations event in September that they will be launching a healthy indoor air initiative in their country. And as a part of that, they have dedicated resources to be able to bring clean air to schools across the country. So I was actually just in Montenegro, arrived back to DC 2 days ago, and spent the week there with some of the leaders, laying the foundation for that initiative and program where there will be installing indoor air quality monitors in schools as a first step. Let's measure the baseline. And then number 2, bringing in mitigation measures to whether that's clean air purifiers or making sure windows work or upgrading some of their heating systems. This has been importantly done in a collaborative effort, like it's the Ministry of Health and the Ministry of Education and the other institutions from environment and ecology that support it. But that's one example action that countries or governments can take, along with, France has been very forward-leaning in monitoring air quality in schools and then also providing guidelines for how to aim for better health-based standards. So that's one category of what can be actions that are taken at a government level. And then in particular, some of these other components like sharing successes and challenges, we think is really critical. So we plan to reconvene in 1 year's time at the United Nations General Assembly in New York next September. And during that period, create an opportunity for everyone to report on progress and share where they have moved forward and where they have faced challenges, as a way to uplift voices, be able to learn from each other. And in some ways, right, whatever Montenegro is doing in launching this effort, how can that be a way for others to learn from or enact in their own way? So excited to be able to create that voice. Those are some examples of ways that next steps can be taken with the pledge.
And I think it's important to say that different countries, different organizations, big enterprise organizations that might sit across all sorts of jurisdictions, they're all going to be strong in some areas, weak in others. The important thing is to bring that shared knowledge together and say, look, Ireland is a good example, introduced a code of practice for indoor air quality in the workplace. One of the few countries with a health and safety standard a broad health and safety standard around indoor air quality in the workplace. They may not be as strong in one of the other areas, accessibility, for example, but it's important that countries and organizations can sign up to this and bring their wealth of experience they have in the areas that they're strong and learn what others are doing in other jurisdictions where they may not feel as strong themselves.
That's exactly the purpose. It's not about perfection. It's about coming on the journey together. And if we collaborate and share what we've learned on the way, we're certainly going to get there much, much more quickly.
And I will also add, Simon, just one other component around the pledge and actions that I've highlighted actions from governments. But as Bronwyn described at the top, this is also for organizations. So this is for universities and schools and healthcare facilities and businesses and nonprofits and community groups. And so all of these can be done. It looks different from, what a healthcare facility might do versus what a university might do. I'm at Brown University. I would love to help support higher level leadership to say, let's support students launching an awareness campaign and celebrating carrying devices around and, helping turn the invisible as an example of how do we educate the public. There could be school districts that want to elevate this or monitor or do other forms of action. So we invite all of those. This is all under one umbrella that we hope can be uplifted in the pledge and progress from the pledge.
And another important thing to say, I think, that is this is a global effort. It is important that we have voices from the global south, from developing countries, where, in many places, a bit like the sustainability agenda, that many of these problems are an economic problem as much as they are a scientific or an engineering problem to solve. And what we don't want this pledge to become is a global north versus global south problem or deviation. That we create tools and best practice for all countries on Earth, that no matter where they're starting from or whatever the challenges they are, there are roadmaps and opportunities and ways of, like you said at the very beginning, Bronwyn, this is about incrementally just doing better each year. We're not looking we're not looking for everybody to reach a platinum air quality standard of some description year one, or not trying because they'll never get there. That this is about how can we, from where we are today, pledge to do better.
Absolutely. And the most pressing issue in one country may be almost irrelevant in another. So I think you're absolutely right. Every country will have its own way of approaching this, prioritising what they need to prioritise first, and all actions are welcome. And I think that everybody will be able to learn a lot on the journey.
We've talked about it a little bit, but I did want to talk about practically what this has manifested into. And the starting point at this was quite an unbelievable event at the UN General Assembly, which to have achieved that in of itself is an enormous achievement. How did you get there, I suppose, is my first question. And then from that peak, which I imagine there's been a bit of a come down since that day, how do you keep the momentum going? What does next look like for this movement? What can we expect to see from this over the next 6 months, 12 months, and so on?
Should I just start a little bit about how, look, previously in my tobacco control work, I had been very fortunate and had attended events at the UN General Assembly previously. And with my work with tobacco-free portfolios, I had hosted events previously at the UN, and I saw firsthand what an incredible platform it was to raise awareness of an issue, to pull in new groups and new stakeholders, and to recruit some new champions, really high-level leaders who could help advance the cause. And so with that, when I got involved in air quality about 4 years ago, I just kept ticking away thinking at some point we're going to need an event at the UN. And my work was really focused on Australia for the first couple of years, and then I started meeting people globally. And to cut a very long story short, I met Georgia in November of 2024, and we were having a very nice conversation, and I kept thinking, gosh, she's done an awful lot. And then she told me she worked for the Biden administration previously and had convened the 2022 White House Summit on Indoor Air Quality, which I did not attend, but I was scrutinizing all of the details from afar and took great note of that. And when I found out it was Georgia who'd put it on, and then I realized she had this incredible network across the US, and I just kept thinking, hang on a minute, I think if we combine forces on this, I think we could do it, and it might be possible. Having said that, you need 2 countries to formally, and the word at the UN is co-sponsor your event, to make that event happen. And I think I'll just let Georgia take over here, because I accidentally, while I'm thinking, gosh, it'd be great to partner with her and put on an event, this would be amazing, then I found out that Georgia was in fact working at a very high level in Montenegro. And then I thought, hang on,
that could be
one. This has got to be possible. This has got to be possible. And it's the hardest thing is to get the first.
Yeah.
It's always really, really hard to get the first. So I'll let Georgia take over.
Yeah, there's this great opportunity. We can bring it to the highest levels, host a UN event, have 2 countries. And then in parallel, I had been having conversations with M. Pang, who's someone at a nonprofit organization that does engineering and open source technology for cleaner indoor air, and also works closely with the Balvi Foundation, which is a foundation that supports, among other things, wanting to bring clean indoor air to more buildings and more countries, and as a layered component of biosecurity and resilience, along with kind of tech innovation and open source. And so the Balvi Foundation, which is the entity from Vitalik Buterin, who is a billionaire that is interested in lots of philanthropic support, had a connection with Montenegro and was interested in supporting clean indoor air in Montenegro. And I shared this earlier story of what Montenegro launched at the United Nations event. And so I was approached by some team saying, hey, you are a clean indoor air expert and have some policy experience. Perhaps we can figure out what could be done in Montenegro. And so this was a beautiful parallel opportunity with Bronwyn saying, let's host a UN event and we need 2 country sponsors. Perhaps Montenegro could be the first. And by approaching that country with this opportunity, they were absolutely delighted to say, let's be on the global stage. Let's share with the world what we'd like to aim and achieve for. Let's set new precedents. And so that was, in some ways, that first, we were able to drive towards the first to get a country co-sponsorship for Montenegro. And then the journey began to say, how can we bring at least one other country along? And as you talked about early, Simon, it is hard. Politics are hard. It's not as easy to say, have a phone call and say, hey, co-sponsor this. There are lots of implications to being involved in an event and signing on to something and signing a global pledge. And so Bron and I then pursued a multi-month path, which included outreach to dozens of countries, and ultimately with Bronwyn's deep previous network and relationships, France was wonderful to come in as the second country co-sponsorship. And then we were on a go and on a sprint path to bring together the biggest community we could with a wide array of speakers to make this global event in September hopefully smashing success, which we were so pleased to bring together.
And it really was a global gathering. You had the likes of Plum from Australia coming in and getting support from people in the community to do so as part of her charity. You had the likes of Sartorius from Spain coming across, advocating for air quality standards, and people from every corner of the world were there. Actually, it really wasn't a North American venture by any means, and including people from the global south. I was really delighted to see SEI there representing India and some of the work they do on the ground with communities in India on air quality. It was as a first step, it was a phenomenal one. And
then Bronwyn to share, we essentially it was kind of fascinating to see. We're like, how can we bring as many people from different parts of the world and different walks of life and perspective to this event? Because we don't want it to be, a small circle of potentially just health champions or just folks from North America and Australia and Europe. And so that was where, colleagues and then friends of friends and friends of friends of friends, suddenly Bronwyn and I's network was, I think when you expand to that, became thousands of people. And we did some also cold outreach to make sure we could have folks from the global south and from India and other places come, and just wonderful to see that come together. And also, I think this concept of Air Club emerged from that effort, which was, there were some people they just got it. And they were such champions from the first moment, speaking about indoor air quality. And this thing that was kind of indescribable of folks that wanted to be a part of a movement. And that was where the concept of Air Club emerged, was as we were doing this outreach, it just clicked with so many people. And we were delighted to at some point kind of come up with a name and concept of introducing Air Club, which is why Bronwyn and I are wearing these yellow canary pins, the symbol of Air Club, which is also, there it is. The canary was the world's first indoor air quality monitor in the coal mines to help you tell you if the air is healthy or not. So we were excited to introduce this at the UN event. And also create a global community of individuals that can be a part of it. Yeah, Bronwyn may add some more.
I just wanted to say, if anybody's listening and didn't come to the event because they didn't know about it, I also want to say that that's because we were just still looking for you, and we're so happy that that we found you now. So if anyone wants to be part of Air Club, we'd love to, have you as part of the community. It's airclub.org. You just sign up and then you'll automatically get our newsletters once we get our act together and start sending newsletters out more regularly. But there are some people who missed out, and a few people who said, I didn't get an invitation, I didn't know. And we're very sorry to anyone who missed it. But the idea was that's the first of many events moving forwards, and we do hope to have many events in different parts of the world to continue to expand this community, make sure that people can connect with like-minded people all across the world, and we can all keep walking side by side together.
These things don't happen on wishes and dreams and unicorn whatnots. Like this stuff has to be funded and be an entity and a thing. What's the plan for Air Club and the pledge? Like, it can't exist in a vacuum. It has to be supported, has to be something in order for it to work. It can't just purely be done on charity and your willingness to raise the agenda of air quality. What's the next steps for the pledge and Air Club as an organisation? Is the plan for it to stay an organisation and continue that way and be supported in some way? And what's that look like, do you think? Do you know yet at this stage what happens next?
Great question, Simon. Excellent. Many questions that Bronwyn and I are currently in the midst of developing and working through, but absolutely yes. The vision is that Air Club is an organization that can exist as a nonprofit to support the further steps of the Global Pledge. We envision continuing to go. So as Bronwyn mentioned, she will be at COP this year. We will plan to attend other global events and bring indoor air quality, put it on the agenda of those additional events, like at the World Economic Forum in Davos, at the World Health Assembly that brings the World Health Organization together, and again at the United Nations. So along with other events. So to continue the momentum, and ideally at each of those, when there's an opportunity at those future events, introduce new signatories to the pledge. In particular, also introduce new governments and create platforms to share their actions and their achievements and their, how they would like to be involved in progressing the pledge. Of course, all of that requires time and people and resources. And so we are a small and scrappy team. Bronwyn, myself, I'm working with also a fellow Scandan at Brown University, great support. And we're also continuing to work with MPing. But our vision now is to fundraise, to grow this effort. We welcome, anyone listening, if you have suggestions or contacts or ways to support this. We'd love to grow this and make this organization really live and breathe, to keep this momentum going for next steps.
So I guess the first step for people is to access the Air Club site, which we'll put links to in the show notes, obviously, and we've mentioned it here today. Start there. And if they want to reach out to you directly, they can contact you through that website, can they?
They can contact us. I guess a quick email would be info@airclub.org. That will come to both Bronwyn and I. Also, if you look us online, you can easily find our emails. And maybe so the three actions that I will say as a call to action for listeners. One, go to airclub.org, sign up for the newsletter, join as an individual, absolutely welcome your involvement, and reach out to us with any ideas or questions. Number two, if your organization hasn't signed the pledge, absolutely welcome that, and ask if you can encourage your organization to sign the pledge. And number three, if you can engage with your local government to also ask them to be a signatory. We really are excited to expand the network and next steps there.
Yeah, brilliant. I said to you before we started rolling on the recording that this is definitely a part one of many parts to come, I think. I mean, both we could spend an hour and a half talking about any one of those pillars, I think, that we describe in the pledge. I think the actions that you're going to undertake over the next 12 months, it's definitely worth us revisiting and talking about how they've gone and how the conversation's going. And certainly as we look forward with a little bit more time and more people knowing about it now towards the General Assembly next year, really start to focus in on that as a landmark event for an update as to where this has got to. Georgia Bronwyn, it's been absolutely brilliant talking to you. It's been a pleasure to get to know you over the last few months. I was thinking right the way back to our first phone call, Bronwyn, when I was one of those who do we know in Ireland conversations I can ring up and have a chat to. So
yeah, that's pretty much what I did. But as George just said, when we had to find that second country and we went for it,
you really had to go.
pulled on every string we had. So thank you for trying to help.
No problem at all. And look, it's been great talking to you this morning, this evening, and late at night, depending on where. Because this has been a genuine global call, Australia and the US and Europe, and so may that continue, that conversation. Thanks both, an absolute million.
Thanks so much.
Thank you, Simon.
Thanks for listening. Before you go, can I ask a favour? Before you shoot off to whatever it is you have to do next, or even the next podcast, if you enjoyed what we've been talking about here, please do spread the word and let's keep building this community. And don't forget to check out our sponsors in the show notes. Ultra Protect, Eurovent, Erico, ACO, Farmwood and Zender, all amazing companies, and without them, this podcast would just simply not be possible. Check them out in the show notes at airqualitymatters.net, and do check out our YouTube channel. All this content is there, plus much more. See you again next week.